So you have a rotator cuff tear. Does that mean you need surgery? Maybe not. I was at the Mid-Atlantic Shoulder and Elbow Symposium this past Friday, and after I spoke on my panel in the morning, Dr. John Cohen gave an amazing presentation. He's from Vanderbilt University, really prestigious physician, and he was discussing a study that they've done that shows that the majority of people with rotator cuff tears, even the full thickness ones, the big ones that are atraumatic, right? They happened over time. It wasn't like you fell on your arm and all of a sudden you have a rotator cuff tear. Well, those sorts of people oftentimes do not need surgery. So in their study, they looked at nearly 500 people and they found that 75% of those people got better with physical therapy. And they looked at outcomes extending all the way out to 10 years. And these findings seem to go hand in hand with other studies that show that many rotator cuff repairs actually fail, meaning that what is repaired doesn't actually stay repaired and in fact almost re-tears back to the way it originally was heading into the surgery. Yet those patients many times still feel pretty good. Functionally, they're able to do what they want. They don't have the pain and all the other issues that they had prior to the original surgery. But that doesn't intuitively make a whole lot of sense. So what is it that explains this? Well, for many of these patients, they went through extensive post-operative rehabilitation and physical therapy after that surgery, and the belief is that that is what led to actually their long-term outcomes, maybe even more so than the surgery itself. Now, am I saying that rotator cuff repairs are useless and nobody should have them? Of course not. There's a time and place for everything, including surgery, and many times it is needed. However, we believe that it is often used more than it may actually be needed because physical therapy oftentimes can solve the issue and producing better functional outcomes without needing the surgery and take that pain away that maybe the person was having prior to the surgery in the first place. Now, the things we work on in physical therapy here at Cohen Health and Performance are going to be varied. We're going to work on exercises that improve the rotator cuff strength itself and the strength of the muscles around the shoulder to then support it and maybe offload the rotator cuff so it's not working so hard. We have a few examples here of some drills that we've used with some of our baseball players as examples. We're also going to work on strength of the muscles around the scapula, the shoulder blade, work on making sure that the shoulder blade is able to move as effectively as it needs to therefore set the shoulder up for success. And of course, making sure we're optimizing our trunk control in regards to how it functions with the athlete in the sport that they play, or maybe the activities that you may like to perform on your own. So if you're somebody who has a painful shoulder and some associated functional limitations, perhaps you know that you have a rotator cuff tear, give physical therapy a shot. Worst case scenario, physical therapy doesn't work, and then you have a surgery that you know is required, but you can't undo a surgery that maybe wasn't needed in the first place. Now, if that's something you're looking to schedule and set up and hopefully nip that shoulder pain in the bud once and for all, contact us. You know where to find us.